This is the treatment position for anterior lumbar 1 counterstrain point. The treatment position is going to be flexed, side bend towards the point, and rotated away from the point. So you as the physician are going to be standing on the same side as the point. So I'm going to find a point on this side. I'm going to flex her knees up. I'm going to rotate her legs towards, which would rotate her torso away. And then to side bend towards, I would bring the feet towards me. And then follow your normal counterstrain steps and then return to neutral. This is the treatment position for anterior lumbar 2 through 4 counterstrain points. The treatment position is flex, side bend away, and rotate towards. As a physician, you will be standing on the opposite side of the counterstrain point. So my hand will go over here to find the point. I will flex her knees up, and to side bend her away, I'm going to bring the feet towards me. To rotate her towards, I'm going to rotate the knees towards me, which would rotate the torso towards the point, and then return her to neutral. This is treatment for anterior lumbar 5 counterstrain point. The treatment position is flexed, side bend away, and rotate away from the point. You are going to be standing on the same side as the point. So I'm going to find the point. I'm going to flex her legs up, and to side bend away, I'm going to move the feet away from the point. And then to rotate away, I would move the knees toward the point, which would rotate the torso away from the point. This is treatment for posterior lumbar 1 through 5 counterstrain points. The same treatment position can be used for the spinous processes and the transverse processes. And so the treatment position is extended, side bend away, and rotate away from the point, which is the same thing as extended, adducted, and external rotation. So you'll be standing on the opposite side of the point. So I'm going to find my point. And if I am treating her left side, I'm going to be standing on her right side. So I'm going to extend the leg, I'm going to adduct it or bring it towards me, and externally rotate it. This is treatment for upper pole L5 counterstrain point. The treatment position is going to be extended, adducted, and external rotation or internal rotation. So you're going to be standing on the opposite side of the point. So since I'm on her right side, I will be treating the point that's on her left. So I'm going to extend her leg, adduct it, so bring it towards me, and then internally rotate or externally rotate. If you do internal rotation and the patient's pain is still above a 3, go ahead and try external rotation and vice versa. This is treatment for lower pole L5 counterstrain point. You are going to be on the same side as the counterstrain point, and the treatment position is going to be flexed, internally rotated, and adducted. So I'm going to find my counterstrain point. I'm going to be on the same side. You'll have your patient laying all the way to the side of the table and make sure it's up high enough that when you bring their leg down, it's not going to touch the ground. So this is flex. I'm going to internally rotate by bringing her foot out, and then adduct by bringing the knee closer to the table. And then return to neutral. This is treatment for posterior lumbar 3 and 4 gluteus medius counterstrain point. You are going to be standing on the same side as a counterstrain point, and the treatment position is going to be extension, abduction, and internal or external rotation. So I'm going to find my point. I'm going to extend the leg, abduct it, so bring it towards me, and internally or externally rotate depending on what position reduces the patient's pain the most.